Welcome back to Learning Anatomy with Dr. Bakare. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the female reproductive system. This is going to be an overview lecture, so ride on with me. The female reproductive system is a collection of organs that perform the function of reproduction. So you see a number of organs coming together to exhibit the function of reproduction. If you look at this image here in this upper region, this is the female pelvic cavity. And within this space is where we have a collection of organs that are referred to as the female reproductive system. This is the region carved out in blue. If you look at this alignment, we have a number of organs collected within this space, and you see it extending even to the outside here in this region. Within this space here, this is the configuration that is seen on the outside. So you have part of the female reproductive system coming from the inside, and you also see it extending also to the outside. And if you go back to this upper image, you see that anterior to the female reproductive system is where we have the urinary bladder, and posteriorly we have the rectum. So we can say that the female reproductive system is a collection of organs sandwiched between the urinary bladder in the anterior part and posteriorly by the rectum. So we are going to be highlighting a number of functions that the reproductive system perform, and also stating specifically the region that is responsible for this function. So the first one is that the female reproductive system acts as a reception site for the penis. We know that the penis is part of the male external genitalia, and it is through the penis that the sperm will run before it is finally released to the outside. In this regard, where it will be released into is the female reproductive system. So we have a section or a specific region of the female reproductive system that tends to receive the penis so that the sperm cell can be released into the female reproductive tract. So if you look at this image down here, the region here that is harrowed in green is where we have the opening of the vagina. So this is where the vagina canal opens into, and it is through the vagina canal that the penis will be inserted into. So you see that the female reproductive system has specific region through which the penis we pass through. The second function is that they're also responsible for the production of hormone. And the hormones that the female reproductive system are seen to produce include estrogen and also progesterone. So we have specific region also within the female reproductive system that is responsible for the secretion of estrogen and also progesterone. For the estrogen, it is specifically produced by the granulosa cell. If you look at this image up here, this is where we have the internal configuration of the ovary. This is what we see in the ovary. And within the ovary, we have follicles growing in different grades. So we have follicles in the primary, secondary, and also tertiary stages. If you look at this image that is harrowed here in red, this is where we have the ovarian follicle. If you look at this follicle, you see that around it, you have lining of cells. And these cells are referred to as the granulosa cell. It is this granulosa cell that is responsible for the secretion of estrogen. And this estrogen is responsible for the development of the female characteristics. It is responsible for the development of the ovarian follicle and also help to thicken the wall of the uterus for implantation to occur. So it also has effect that it exerts within the reproductive system in also helping to support reproductive activities. We also have the production of progesterone. Progesterone is produced by the corpus luteum. Remember, going to the internal configuration of the ovary, we say we have a number of follicles growing at different grades. This is the mature follicle. After the maturation of this ovarian follicle, the egg will be released, and this process is referred to as ovulation. You can see here at this point, there is a release of an egg or an ovum. And after this release, the remaining shaft of the ovarian follicle will assume a temporary secretory function. And this is this structure that is referred to as the corpus luteum. This is the structure here, harrowed in black. This corpus luteum will begin to secrete progesterone, because we know that after the release of an egg, the next phase is for fertilization to occur. And of course, after fertilization, implantation within the uterus also should follow suit. And for implantation to occur, progesterone will be secreted by the corpus luteum, which is referred to as the pregnancy hormone. This hormone will act on the endometrium lining of the uterus so as to prepare the uterus for implantation. So as the process is occurring within the ovary, it is also producing hormone that will have effect on other reproductive organs so as to prepare them for subsequent actions. So this is what happens in the configuration of the female reproductive system. So if you look at this image up here, this is where we have the ovary, arrowed here in red. And within the ovary is where we have the presentation that is expressed on this other side. If you look at this lower image here, this is where we have the ovary also arrowed in red. Then also going to the next function, the female reproductive system is responsible for the production of mature sex gametes. These sex gametes are basically ovum or the egg. So the production of a mature egg that is fertilizable is also a responsibility of the female reproductive system. And of course, this process occurs within the ovary. Within the ovary is this structure that is expressed above. So if you zoom in into the ovary, you see that what is seen basically on the outer cortical region is ovarian follicles. These follicles are growing at different stages. And of course, the most mature one will be released finally. So the female reproductive system, specifically the ovary, is also responsible for the production of a mature egg. Then also, the female reproductive system also creates sites for fertilization to occur. So also within the female reproductive system, we have specific region of it that is designed and also suits the process of fertilization. Because for fertilization to occur, it is not as easy as it sounds. It is beyond a mature egg being fertilized by the sperm cell. There are a number of processes that must occur before effectively the egg must be able to mate with the sperm to form the zygote. So we have a specific region within the female reproductive system that is able to provide this atmosphere for fertilization to occur. So if you look at this image up here, this is where we have the uterine tube. This uterine tube is also referred to as the fallopian tube or the oviduct. This is what is arrowed here in blue. In this image down here, this is where we have the fallopian tube or the oviduct, or also referred to as the uterine tube. It is within this uterine tube that the fertilization process will occur, specifically within the ampulla. So the ampulla region is the middle subregion of the fallopian tube. And this region is specifically designed for the process of fertilization to occur. Then the next function is that the female reproductive system creates sites for implantation. We say that the mature egg is released during ovulation. Using this image down here, the mature egg is released by the ovary. It is being sucked up by the fimbriae of the oviduct, which is a finger-like expression at this region, and driven into the fallopian tube. We say that the specific region of the fallopian tube in the ampulla region, fertilization will occur. After fertilization has occurred, the next phase is for implantation to occur. Because if you look at the configuration of the oviduct or the fallopian tube, you see that the space is not big enough to accommodate the growth of the developing embryo. That is why the fertilized egg, which is also referred to as the zygote, is taken back into the uterus where implantation will occur. So if you look at this image up here, this is where we have the uterus, they're arrowed in yellow. After fertilization in the fallopian tube, it will be taken back into the uterus for implantation to occur. If you use this image down here, we have the release of the egg from the ovary here, arrowed in red. The egg is then taken or driven into the fallopian tube, where it will be fertilized in the ampulla region that is arrowed here in blue. After fertilization, it is redirected into the uterus, which is this region here that is also arrowed in yellow, where implantation will occur. So you can see that specifically the uterus, which of course is part of the component of the female reproductive system, is creating sites for implantation to occur. Then the next one is that they provide a conducive environment for gestation and also further development of the implant. So after implantation in the uterus, there's also further development into the normal human form. And of course, it is within the uterus that this process would occur. So the uterus also is creating a conducive environment for the development of the implant. Then the female reproductive system also creates a path for the delivery of the fetus. After implantation in the uterus, the baby will continue to develop and grow in the uterus. And after they have attained the full form, which of course is that time for delivery, the female reproductive system is also going to be creating a channel through which this will be done. If you look at this image up here, this is where we have the vaginal canal, and it is through this vaginal canal that the baby is released. Then also finally, even though the breast is not located around the space where we have the female reproductive system, the breast is classified as an accessory reproductive organ in female. This breast is also responsible for the production of milk, which of course is used to nurture the baby after delivery. So these are the different functions that the female reproductive system exhibits, and we've also tried to link each to specific organs within the female reproductive system. So generally, the female reproductive system is divided into two subregions. We have the internal genitalia. Just as the name implies, internal, it means a collection of organs located within the body, and of course are seen to perform the functions of reproduction. So this region here that is carved out or demarcated in dotted yellow, we have a number of organs within this space that are embedded within the body. Then we have the external genitalia, just also as the name implies, are located on the outside. They are seen on the surface of the body around the perineum. So if you look at this image here, this is where we have the external genitalia. These structures here are also part of the female reproductive system, but are located outside the body. And that is why they are so named external genitalia. So this is where we have the external genitalia also carved out in dotted yellow. So this region is seen to be located outside the body. So you see it on the surface of the body around the perineum. So these are also taken as part of the female reproductive system, but they are just regions that are seen outside the body. So we're taking each of these subregions one after the other to see their structural components. So first, the internal genitalia. A number of organs are seen to make up this internal genitalia. So this is where we have the internal genitalia organs here carved out in dotted blue. So the first organ that is seen to form the internal genitalia is the ovary. The ovary are two in number, so we have two ovaries. And if you look at this structure here, this is where we have the ovary here, arrowed in yellow. If you look at this lower structure here, this is where we also have the ovary here, also arrowed in yellow. So we have two, we have one on the right and one on the left. And we know that in the ovary, we have the process of folliculogenesis going on. And of course, this process is what will birth the production of mature egg. And after which the process of ovulation, which is the release of this mature egg, will occur. Then the second structure is the uterine tube. The uterine tube is a tubular extension of the uterus. If you look at this image up here, this is where we have the uterine tube here arrowed in red. The uterine tubes are also two in number. If you look at this lower image here, this is where we have the uterine tube arrowed in red. We have one on this side and one on the other side. The uterine tube, basically, as we said, they are extensions from the uterus. And what they do is that they create a site for fertilization. We've tried to explain this in our previous slide. We tried to highlight the functions of the female reproductive system. And the next one is the uterus. In this image up here, this is where we have the uterus here arrowed in white. In this lower image here, this is where we have the uterus. The uterus we've also described as a site where we have implantation. And also within this space, the development of the implant will occur until when they develop to full form. If you look at this image, the uterus here is arrowed in white, as we've said, and you see it anteverted over the urinary bladder. Remember, we said the urinary bladder is an anterior relation of this collection of structures that are referred to as the internal genitalia. So if you look at the relationship between the urinary bladder and the uterus, when pregnant women go for scan during antenatal care, they are asked to drink water. And this water is to allow the urinary bladder to be full. When the urinary bladder is full, it's going to push on the uterus. It's going to make the uterus to stand more vertical so that the scan can fully capture whatever it is that the uterus is carrying. So if you look at the position of the urinary bladder and the uterus, you can use that to justify that procedure. Then finally, the last internal genitalia organ is the vaginal canal. This is where we have the vaginal canal here in this upper image here, arrowed in purple. At the inferior part of the uterus, we have the vaginal canal. In this image here, this is where we have the vaginal canal, also arrowed here in purple. Is the space that receives the penis. Of course, it is through it that the sperm is introduced into the female reproductive system. It is also through this vagina that the fully developed fetus is released part of the body. So we can see that the internal genitalia are structures that are located within the body. Then going to the external genitalia. External genitalia, just as the name implies, are structures that are seen on the surface of the body on the outside. And this collection of structure here is referred to as the vulva. So this region is the vulva. If you look at it, we've tried to describe the internal genitalia organ on the inside. And around this space is where we have the external genitalia organ. So in trying to expand this region, this is the kind of configuration that would be seen. So let's try and list the organs that are seen to form the external genitalia. So the first one is the labial majora. The labial majora is the outer bigger lip. If you look at the configuration of the vulva in this region, you see that we have this region here that's arrowed here in yellow as the outer bigger lip. So after this outer bigger lip, we also have an inner smaller lip, which is arrowed here in blue. So this is the inner smaller lip, and this is referred to as the labia minora. From the name, majora is bigger, minora is minor, which means it's smaller. So you have two lips, one on the outside, of course, is bigger, and you have another one on the inside that is smaller. And they are so referred to as the labia majora and the labia minora, respectively. Then if you look at this structure in the anterior part, this is the upper part, this is the anterior part, and this is the posterior part. This is where we have the anus. So this is the posterior region. So if you look at it, you see that in the anterior part, the labia majora come together here. The labia majora, we have one lip on the right, we have another lip on the left. So these two lips will come together in the anterior part, and they will be seen to form the mons pubis. And this is the mons pubis here, arrowed in black. This mons pubis is formed in the anterior part, is a fat pad in the anterior part of the labia majora. As we have this kind of configuration formed by the labia majora, we also have it formed by the labia minora. If you go to the labia minora here, that is arrowed in blue, which is the smaller inner lip at the upper part here in the anterior region, they also unite to form the clitoris. And this is where we have the clitoris here, arrowed in red. So you have the clitoris being formed anteriorly by the union of the labia minora, which is the smaller inner lip. So if you look at this configuration, I think establishing it in this way will be very easy for us to understand. And we know that the clitoris is a very sensitive area because it has a number of nerve endings, and that is why it is highly sensitive. So this is kind of presentation that you see in the external genitalia. It's good for us to add that the space created between the two lips of the labia minora is the vestibule. So this vestibule is the space around this region that is guided by the right and the left lip of the labia minora. So this space is not closed off. This space allows for two openings. And the two openings that are seen around this region are the urethral opening above here, that is arrowed here, and inferiorly you have the opening of the vaginal canal. If you look at this image up here, we say that we have the female reproductive system or tract sandwiched between the urinary bladder anteriorly and also the rectum posteriorly. If you look at the anterior part here where you have the urinary bladder, you have the urethra connected to the urinary bladder at the inferior part. So this is where we have the urethra here. And of course, the urethra is to allow for the passage of urine. So urine that is stored in the urinary bladder, after being filled to capacity, signals will be sent to the brain for it to contract so that the urine will be released. And this release will be done through the urethra. And this is where we have the urethra. And this is what is arrowed here up, because this is the anterior part and this is the posterior part. And we say that in the anterior region, we have the opening of the urethra. Of course, this is the anterior part also. This is where we have the anus. So behind is where we have the opening of the vaginal canal. And if you look at it behind, this is where we have the uterus. And inferior to the uterus, we have the vaginal canal. Finally, the vaginal canal will be open to the outside through the vaginal orifice or the vaginal opening. So you can see that this alignment of course, is exactly as what is presented here in this image. So you also have the urethral opening up, which is in the anterior part, and behind, which is in the posterior part, you have the vaginal opening. So it's good for us to highlight this, that within the vestibule, we have two openings. At the anterior region, we have the opening for the urethra, which of course allows for the passage of urine. And posteriorly, we have the opening of the vagina, which creates sites through which the penis is introduced into the female reproductive tract. It also creates an allowance for the passage of the fetus. So thanks for watching this video. Let's continue to stay glued to this channel.